Knock knock, hi, how are you?
I'm good, thank you.
My name is Allison, I'm your nurse. I'm going to wash my hands for your safety. Can you verify your name and your birth date for me?
Brooke Peters, 8/14/81.
Very good, I just want to verify that that's what I have on record, and it is. Make sure that I'm seeing the appropriate patient, okay? I'm going to be doing a neurological exam on you today, and the first thing I'm just going to start with is your appearance. I'm just looking to see how you're dressed today. You appear well-groomed, you don't look disheveled, your dressing is appropriate for the summer months. You don't appear to have any spinal deviations or involuntary movements, so that's very good. And then can you tell me how you got here today?
I drove my car.
And what day is it?
Saturday, July 6th.
And who was the president before Obama?
Bush.
Very good. I'm just checking your recent and remote memory, and that's intact. That's normal. And then also your cognitive thought process is clear and appropriate. You appear maybe a bit anxious, but otherwise you don't have any abnormal moods or affect. Next thing I'd like to do is go into the cranial nerve assessment. The olfactory is cranial nerve number 1, and I'm not going to assess that today. Have you been noticing any problems with your sense of smell?
No.
No, okay. Have you been having any trouble with vision lately?
No.
No, okay. Cranial nerve 2 is your optic nerve, and normally I would assess that with your peripheral fields and your visual acuity, but for today's exam we're not going to do that.
Okay.
Do you get regular eye exams?
Mm-hmm.
Very good. Okay. We're going to move on then to cranial nerves 3, 4, and 6. We test them together. That's your oculomotor, your trochlear, and your abducens cranial nerve. And I'm going to look at your eyes, just looking at the shape and symmetry, okay?
Okay.
And I'd like you to just look right at me. And I'm looking at your eyes for a response to the light, a direct and a consensual response for your pupils. I'd like you to follow my finger. Very good. Your pupils are equal, round, and reactive to light and accommodation, and that's a normal finding.
Okay.
The next thing I'd like to do is have you follow my finger, just without moving your head, please. And I'm going to move it in the cardinal position. And I'm looking for any abnormal or involuntary eye movements or nystagmus. And I don't see any of that. It would be normal to have some nystagmus on an extreme lateral gaze, but I don't notice any, and that's normal.
Okay.
The next thing I'm going to do is move on to cranial nerve 5. That's your trigeminal nerve. And so what I'd like you to do when I touch your face is just clench your muscle. Very good. Very good. And I'm looking for symmetry of strength there. And I'd like you to tell me which side of your face I'm touching with. Close your eyes, please.
My left cheek, right cheek, forehead, chin.
Okay, that's very good. And I'm looking to see if you can differentiate soft touch on your face. Okay? The next thing I'd like to do is check cranial nerve number 7. That's your facial nerve. And so I'd like you to just make some faces with me.
Okay.
Eyebrows up, eyebrows down. Can you smile a big smile, frown, and puff out your cheeks? And that's normal. I'm looking for symmetry and strength of the facial muscles. And I don't notice any weakness on one side or the other. That could indicate a potential neurological defect.
Okay.
Cranial nerve 8 is your acoustic nerve, and I'd like you to cover one ear. And then I'm going to whisper something. Just let me know what I whisper. Baseball, flowers, computer.
Baseball, flowers, computer.
And on the other ear, cover the other ear. Baseball, flowers, computer.
Baseball, flowers, computer.
Very good. And do you have any trouble hearing that you know of?
Nope.
Okay, very good. The next thing I'd like you to do is open up your mouth, and I'm going to look in your mouth. Okay, this is cranial nerve 9 and 10, your glossopharyngeal and your vagus nerve. So open and go ah.
Ah.
Very good. And I'm looking to see that your uvula rises when you say ah, and it does. I'm not going to track your gag reflex, but that's an additional test that we could look into.
Okay.
Your voice doesn't appear or sound hoarse, rather. Have you had any cold or cough lately?
Nope.
Very good. The next thing I'd like to check is your spinal accessory muscles. So shrug up against resistance. Very good. And now turn your head to the right and to the left. And that's against resistance. And I'm looking for symmetry of strength bilaterally, and I have that. The next thing I'd like you to do is stick your tongue out. Very good. That's cranial nerve 12. That's your hypoglossal nerve. Do you have any questions about the cranial nerve so far?
No.
Okay, the next thing I'd like to do is your sense of motor function on each side. So I'd like you to squeeze my hand. Very good. And now put your palms out, push up, and then push down. Very good. And I'm looking for strength and symmetry on both sides. And the next thing I'm going to do is check your lower extremities. So I'd like you to push out. Very good. And pull back. And then feet up and feet down. And we're looking at dorsiflexion and plantarflexion, and that's normal. Symmetry of strength bilateral.
Okay.
The next thing I'd like you to do is, can you tell me if you have sensation? Tell me where I'm touching on your body. I'm going to check painful or dull, okay?
Okay.
So close the eyes.
Painful on my arm. Painful arm. Painful arm. Dull arm. Painful right leg. Dull right leg. Painful left leg. Dull left leg.
Very good. Okay, the next thing I'd like you to do is just stay there, and I'm going to check some vibrations. I'm going to check it in some different spots on your body.
Okay.
If I could have your hand, tell me when you feel the vibration and when it goes away.
Feel it right away. Gone.
Okay.
Feel it. Gone. Feel it. Gone.
Very good.
Feel it. Gone.
I'm looking to see that you're feeling this on the bony prominence.
Feel
there.
it. Gone. Feel it. Gone. Feel it. Gone. Feel it. Gone. Barely feel it. Gone pretty quickly. Feel it. Gone. Feel it. Gone. Feel it. Gone.
Very good. Your sensation of the vibration is intact, and that checks your spinal column tract.
Okay.
The next thing I'd like you to do is I'm going to put an object in your hand, and I want you to tell me what this object is, okay?
Mm-hmm. That's a key.
Very good. Thank you. The next thing I'm going to do is check your reflexes, okay? So I'd just like you to relax, all right?
Mm-hmm.
I'm going to check your bicep and your tricep reflexes. Your bicep reflex. And let your arm hang limp. Very good, and that's your tricep reflex. And then on this side, I'll also check your bicep. Very good. And let your arm hang limp. Very good. Now we'll move to the lower part of your body.
Okay.
I'm going to check your patellar and your Achilles reflex, so try and just relax. Very good.
That was a big one.
That was active. And then your Achilles. And those are all 2+ on each side, and that's a normal finding.
Okay.
The last thing I'd like you to do is stand up, and I'd like you to do 2 things. Number 1, do a rapid alternating movements with your fingers. Very good. And then I'd like you to just stand and shut your eyes. And I'm checking the Romberg test. I'm making sure that, number 1, you don't fall over. I have my hands here for safety. And this is assessing your cerebellar function, which
Okay.
is normal. I'd like you to walk to the door and back, please. I'm assessing your gait and balance. Steady gait and balance. Very good. Any questions for me today?
I don't think so.
Okay, I'm just going to wash my hands, and thank you very much for your time.
Thank you.
Did you stop it?
Trying.